in today's class, we shall be talking about phlebotomy. You and I must have heard about the word phlebotomy. Phlebotomy is a Greek word. It came from phlebs, meaning vein, and tomia, meaning curtain. So today we shall be teaching the new practitioners on the right way, on the professional way to perform this procedure. First of all, when a patient accesses the healthcare center, especially the lab for this procedure, the first thing you're expected to do is to establish rapport. Then check the patient's request form to ensure that that is the patient you are supposed to attend to. Then, proceeding further, coming to the site where you can perform this procedure, some persons use the dorsal part of the hand while some use the antecubital fossa. This antecubital fossa most times is the ideal region or site for you to collect this or perform this procedure. So when you come to the brachial, the antecubital fossa, okay, we have three major veins. The median vein, which is most common, that you and I use most of the times. Then we have the cephalic vein, okay, and then we have the basilic vein. In some patients, it can appear as an M or H. But looking closer to this patient's antecubital fossa, it's looking like it's in the form of an M-shaped. So most of the times we use just the median cubital vein and the cephalic vein. We do not make use of this basilic vein because of the association it has more with the nerves, with the tendons, with muscles and arteries. So the two most preferred veins are the cephalic vein and the median cubital vein. Then proceeding further, when we want to tie the tourniquet, we tie it 3 thumbs above the site of collection. This will help to engorge the veins, and this is how we tie the tourniquet. You stretch it out and then you pull it up and then you make like you're tying the lace of a shoe, and then that's it. Okay, naturally or professionally, this tourniquet is not permitted to last more than 2 minutes. Some authors would say 60 seconds, but we are saying 2 minutes to allow, in order to allow the sterilization liquid, which we know as the 70% alcohol, we use to sterilize the site, to dry up and then perform our procedure. And when we want to remove, we just pull up this upper part and then that's it. So we are going to go right there into the procedure. So we are going into the procedure proper. First of all, you perform hand hygiene, that is washing of hands. After washing hands, the next is that you sanitize your hand with an alcohol-based hand sanitizer, and you make sure that you enter into the interdigital spaces. Then you allow it to dry, after which you put on a sizable gloves. The gloves doesn't need to be sterile. Then after sanitizing your hand, you wear a latex gloves. It doesn't really need to be sterile, okay? Then the next is that you've already done your vein assessment and you already know the site where you want to perform your phlebotomy. So the next is for you to sterilize the region. And this comes, it is not done like this. This is a wrong procedure. The right way for it to be done is with our 70% impregnated cotton wool. You go right from the center, you apply a little pressure, then outside away from the place where you perform the phlebotomy. When you clean, you look at the cotton wool to check if it is dirty, and if it is, you need to perform the second sterilization. So you start from inside out again, then you sterilize the region, allow it to dry. The reason why we do not apply our tourniquet is because this is a class, so it doesn't last more than required. Okay, so the next is to do what? To apply the tourniquet. Remember, you stretch it out and then you knot it like the lace of a shoe, 3 fingers or 3 to 4 inches above the site of collection. Then we are using a syringe, okay, a 5 ml syringe. Most times people open it like this or just tear it carelessly. No, the right way for you to open any kind of syringe you're using to avoid or limit contamination is like this. When you look at the head, you can see 2 flaps. So you pull the 2 together. You ensure that it's on a surface, and then you cap it. When you cap, there is no need removing this protective cap over the needle. For you to check if the bevel of the needle is rightly positioned, it still needs to be inside this needle cap. Okay, so you don't need to pull it out because we know that organisms are everywhere, and when you pull it out, they can attract some organisms, or organisms can settle on it. So the next, we must have the dry swab or the dry cotton wool. It is very wrong in some practice. They use a wet cotton wool after they must have performed the procedure. The right cotton wool to use is a dry kind of swab or cotton wool or gauze, okay, over the place where you have already performed the phlebotomy. So again, some practitioners, when they have sterilized the area and perhaps they're not seeing the veins, they'll come and slap the region. When you slap, it is expected that you do what? You re-sterilize. But in a normal practice, it is not always ideal to slap the vein. Rather, there are many ways to maneuver through the vein. You can tell the patient to clench his or her fist, or to rotate the arm. Again, you should also check if the patient is well hydrated, because at times when they are not well hydrated, the veins can always do what? Collapse. And again, when you're using the dorsal, please can you turn your hand? When you're using this kind of veins, they are prone to collapse. And that is why you discover that most learners, like new beginners in the profession, when they use this vein, they will miss it. They will always miss it, because these distal veins are prone to collapsing when they are being punctured. Okay, and again, they are not usually straight, and the turbidity is not really as high as the one found in the median cubital fossa. So right now, so I'm going to ask the patient, please, what's your name? Okay, what's your surname? The essence of asking a patient this question is to ensure that this is the right person, the right patient that I'm supposed to perform this procedure, because the worst thing that can happen to any practitioner is to perform a procedure on the wrong patient. So right now I have cross-checked the form and I have seen that, okay, that she's the one. How old?
20 years.
Okay, all right. So you are here to perform this phlebotomy because we need your blood for some analysis so that we can help you recuperate as soon as possible. So I would like you to cooperate, and I know that the procedure will be less painful if you do. We collect the blood sample, ensure that the container is not yet expired. It has the patient's name on it, the date of the collection, and the name of the test that will be performed. Okay, so in this video we are using the EDTA container, okay, for our sample. So you pull the cap, and then using the thumb you pull the skin. This is to ensure that the skin is well smoothened out before performing the procedure. You do this gently until you have collected the necessary volume of blood. Then the next is to do what? Remove the tourniquet and then gently remove the needle, and then you apply this dry sterile cotton wool swab. We do not recap. This is how we do it. You take it closer to the cap and then you ask the patient to please hold it. Immediately after collecting, you remove the cap and then you discard into the biosafety box. Then the next is, this is how you open the container. Then you empty the blood into it. Then you recap. You discard into the highly infectious waste, and then you try and mix the blood gently. You do not do it like this or in a fast mode, because it's going to lyse the cells and thus giving a false result when it is being analyzed. So it is mixed slowly so that it will prevent coagulation. So next, you do not tell the patient to bend the arm when you're performing this procedure. That is, after you have finished surgery, the patient should extend the hand and then lift it up. When the patient bends the hand, it can cause hematoma. Thank you for watching, and if you have any comments, please add on the comment section. Thank you.